I know you know. You've seen it, experienced it, affected by it. Of course, it's hard. But this is an invitation to change it, to bounce back, to feel the inspiration. Masyado ka nang apektado para tumigil pa. Ngayon, oras na para sa mas mataas na antas ng pagbabalik at pagbabago. The hashtag, business as usual. Oo naman, aangat ka, aangat tayo. The 58th PMAP Annual Conference. Angat, leading people to higher ground. Be the soul of change. Be the pusher of encouragement. Be the fuel of moving forward. Angat, leading people to higher ground. The 58th PMAP Annual Conference. Dahil mas personal na ang trabaho ngayon. You've seen it, experienced it, affected by it. Of course, it's hard. But this is an invitation to change it, to bounce back, to feel the inspiration. Masyado ka nang apektado para tumigil pa. Ngayon, oras na para sa mas mataas na antas ng pagbabalik at pagbabago. The hashtag, business as usual. Oo naman, aangat ka, aangat tayo. The 58th PMAP Annual Conference. Angat, leading people to higher ground. Be the soul of change. Be the pusher of encouragement. Be the fuel of moving forward. Angat, leading people to higher ground. The 58 PMAP Annual Conference. Dahil mas personal na ang trabaho ngayon. You've seen it, experienced it, affected by it. Of course, it's hard, but this is an invitation to change it, to bounce back, to feel the inspiration. Masyado ka nang apektado para tumigil pa. Ngayon, oras na para sa mas mataas na antas ng pagbabalik at pagbabago. The hashtag, business as usual. Oo naman, aangat ka, aangat tayo. The 58 PMAP Annual Conference. Angat, leading people to higher ground. Be the soul of change. Be the pusher of encouragement. Be the fuel of moving forward. Angat, leading people to higher ground. The 58 PMAP Annual Conference. Dahil mas personal na ang trabaho ngayon. you know. You've seen it, experienced it, affected by it. Of course, it's hard, but this is an invitation to change it, to bounce back,
and thank you so much for your gift of presence in this webinar on the Philippines COVID-19 vaccine rollout plans. I'm Ging Igual from Willis Towers Watson, and I'll be your host only for the first part of this session, sponsored by, of course, by the Philippine Management Association, People Management Association of the Philippines. Before we start, ladies and gentlemen, we just have a few reminders. For an interrupted webinar experience, make sure that you have a stable internet, definitely, that's one. And of course, for an enhanced viewing experience, please set your Zoom window, all right, to full screen view on your laptop. You see the reminders on the screen. All right, for better sound reception, use a headphone or an earphone. And of course, in case you have questions, you may send it to us using the Q&A button, or for those watching on YouTube, please post your questions in the comment section and we will try to answer it, because we will have a collective Q&A after the session. And as of this morning, ladies and gentlemen, guess what? There's a lot of you, more than 500 participants really signed up for this webinar. And while we are aware of the capacity limitation of Zoom, we opted not to close the registration. Do you know why? Because we can actually accommodate everyone by live streaming through PMAP's YouTube channel. So if you cannot access the Zoom link, search for the page of PMAP. You know that already, People Management Association of the Philippines, or search for @PMAP 1956. So to officially start this webinar, ladies and gentlemen, let's all start with a prayer.
Hello, pretty ladies, Ging and Pinky.
Good afternoon po.
Hi, Ging and Pinky. Ang gaganda nyo. How are you?
Good afternoon.
Good afternoon.
Lord, make me an instrument of your peace. Where there is hatred, let me sow love. Where there is injury, pardon. Where there is doubt, faith. Where there is despair, hope. Where there is darkness, light. And where there is sadness, joy. O Divine Master, grant that I may not so much seek to be consoled as to console, to be understood as to understand, to be loved as to love. For it is in giving that we receive. It is in pardoning that we are pardoned. And it's in dying that we are born to eternal life. Amen.
Thank you so much. Okay, so you know, ladies and gentlemen, the Philippine government recently approved and ratified its official deployment and vaccination plan as part of the nationwide immunization campaign to combat coronavirus. And we expect the first, of course, we expect the first vaccine supply to arrive within this month or the first quarter of this year. No? This webinar, ladies and gentlemen, has very simple objectives, and that would to give everyone insights, information on what you need to know about the vaccine rollout. No? Beyond its relevance, we also would like to share information from procurement to post-vaccination, like, you know, how the things that you would like to know more about this vaccine, what are the possible side effects, and a lot more. So to formally introduce our speaker, and to be our moderator for the Q&A session, ladies and gentlemen. Let's all welcome the 2019 PMAP Cebu President, currently the member of 2021 PMAP Data and Research Group and PSOF Visayas Coordinator. Ladies and gentlemen, a round of applause for Ms. Pinky Monte.
Thank you so much, Ging. It is definitely an honor to introduce our resource speaker for this afternoon. Our speaker currently serves as Cabinet Secretary appointed by President Rodrigo Duterte in November 2018 to head the Office of the Cabinet Secretariat. He serves as close advisor to the President and ensures close coordination among the different agencies of government such as DILG, DPWH, DSWD, DOH, and others. He is committed to helping the President deliver on his promise to bring development to all regions, provide more opportunities to those living in the provinces, and uplift the economy, especially in the countryside. He is also a staunch advocate of advancing programs against hunger to end and overcome hunger concerns in different parts of the country, find solutions to water shortages in households while expanding irrigation and agricultural lands, and to finally achieve the long-term peace in Mindanao. Before he was appointed as Cabinet Secretary, he was chair of the powerful House Committee on Appropriations, which approves the national budget for the annual expenses of the government. He served as a 3-term congressman of the 1st District of Davao City, a lawyer by profession. He previously worked for the Nograles law firm in Davao City. Our speaker this afternoon is a recipient of numerous prestigious awards as an outstanding legislator. He received the Golden Globe Awards for Excellence in Public Service in 2015 and 2016. He was also recognized as an outstanding congressman in 2012 and 2015 by Super Brands Marketing International. A graduate of Philippine Science High School, he holds a degree in BS Management Engineering from the Ateneo de Manila University and a Juris Doctor from the Ateneo de Manila Law School. He was born and raised in Davao City, the second among 4 children of Prospero Nograles, the former Speaker of the House of Representatives, and Rodoro Bendigo Nograles, a cousin of President Rodrigo Duterte. Friends, please help me give a warm virtual PMAP welcome to Cabinet Secretary Carlo Alexei B. Nograles. Mr. Secretary, good afternoon po.
Thank you very much, Ma'am Pinky. To our PMAP President, Ms. Lynn Muki, PMAP Executive Director Rene Henel, members of the board and chapter members of PMAP, ladies and gentlemen, maayong hapon, kaninyong tanan. First of all, I would like to express my gratitude to the People Management Association of the Philippines for inviting me to speak in this webinar that is centered on one of the most critical stages of our COVID-19 fight, the procurement and deployment of the much-awaited vaccines. I'm grateful that you're doing this kind of online engagement in order to provide your participants and the viewers vital information about developments and the latest updates about the COVID-19 vaccines so that they can make an informed decision about their vaccination options, as well as to show to them the efforts of government to bring meaningful solutions amidst this pandemic. For this webinar, I'm tasked to speak about the vaccine rollout plan of the government and what key role our local government units and the private sector holds. With this, let me share with you that our country remains steadfast in its battle against COVID-19. It will leave no stone unturned to ensure that all Filipinos are safe and bring a greater sense of normalcy to our nation. Our fight against the COVID-19 pandemic necessitates a whole-of-nation approach. This allows efforts to be synchronized and integrated in all sectors. It affords committed leadership and good governance in all mechanisms in fighting this virus, which is cascaded from the President himself all the way to the Interagency Task Force and the National Task Force, to the Department of Health and the Department of the Interior and Local Government, providing critical functions in eliciting participation of government agencies, local government units, and their respective chief executives, and the private sector as well, Finding ways to address this health crisis has been very challenging, not just for the Philippines, but for countries across the globe. With more than 2 million deaths globally, around 11,000 plus of which come from our country. Our efforts to lower our mortality rate has remained among our main priorities. Hence, despite the limited supply and massive global demand for the vaccines, we were able to negotiate and secure over 100 million vaccine doses at a lower price, or the same price offered to the COVAX facility. We want to caution the public on the prices of vaccines circulating online and in some publications. These are market prices and not the COVAX prices that we are in current negotiations with vaccine manufacturers. In fact, some of the COVAX prices are 300% lower than market prices. In as much as we want to disclose the price list of these vaccines, we are bound by the confidentiality agreement. But in due time, once negotiations are already finalized and there is already a purchase agreement, supply agreement, all of these prices will be publicized and published and will be subject to audit by the Commission on Audit. Government maintains a portfolio of vaccines, and this contains all the brand names and manufacturers of vaccines that are under development. From this portfolio, government identifies the companies it will negotiate with. All our decisions are based on the recommendations of our vaccine and health experts who have seen promising results in the candidate vaccines. As we are in a race against time to ensure that we will be able to obtain access to safe and effective vaccines, government immediately commenced negotiations with many vaccine manufacturers from various countries, even as their products were still under phase 3 of clinical trials. Nevertheless, we want to assure everyone that all vaccines to be purchased by the government will undergo the most stringent evaluation and selection process of the Food and Drug Administration, or our FDA, to ensure the safety and efficacy of these vaccines. Only FDA-approved vaccines, those for emergency use authorization or even for clinical trials, will be used in inoculating the Filipino people. Regardless of brands or from whatever country they come from, all vaccine candidates undergo the same rigorous regulatory review procedures. We still expect and are quite hopeful that the first batch of vaccines will arrive this month. Hence, we encourage everyone to look beyond brands and get immunized once the FDA-approved vaccines are available in their respective areas. We all want to protect ourselves and our loved ones against the virus, and getting the vaccine is one of the best ways to achieve this. The World Health Organization, or WHO, believes that the Philippines is on the right track for a successful rollout of the vaccines to protect all Filipinos from COVID-19. This can be seen in terms of regulatory readiness, the presence of a national vaccination deployment plan, the availability of our storage facilities, and the safety monitoring plans to check for possible adverse effects of the vaccines. All of them in keeping with the criteria as set and prescribed by the WHO. Our government has also approved and ratified the Philippine National Deployment and Vaccination Plan for COVID-19 vaccines, and is now set to implement a nationwide immunization campaign to combat the coronavirus. Included in these plans are necessary processes in terms of selecting, evaluating, accessing vaccines from different providers. And the plan indicates the prioritization mechanism as well, and the criteria for technical evaluation of the shortlisted vaccines. It highlights the country's vaccine distribution and deployment procedures necessary to determine and prioritize the vaccine recipients. So, in prioritizing the recipients for the vaccines, identification of eligible populations were identified based on the WHO Strategic Advisory Group of Experts on Immunization Values, or the SAGE Values Framework, for the allocation and prioritization of COVID-19 vaccination. In addition, the recommendations of our National Immunization Technical Advisory Group, or NITAG, of COVID-19 vaccines guided identification and finalization of the eligible population. This takes into consideration the national context, the epidemiological settings, and the COVID-19 vaccine characteristics and supply. So the SAGE Values Framework provides the overarching goal and the 6 core principles that guide the distribution of vaccines. So you will see there in the slide, of which 5 were adopted by the country. The following principles are: number 1, public good, wherein vaccines shall be the main prevention commodity and shall be made available to all as a public good. Number 2, human well-being, where health, social and economic security, human rights, and civil liberties of all citizens and individuals are protected and promoted. Number 3, reciprocity, where individuals and groups who have greater burden in COVID-19 pandemic response and have higher significant risks brought by their responsibilities and roles shall be given greater priority. 4 is equal respect, where all human beings are treated equally and their interests are considered with equal moral consideration. 5, national equity, where equity in vaccine access is assured nationally and those with greater burden of COVID-19 pandemic. And 6, legitimacy, where decisions are made through transparent processes based on shared values and scientific evidence. So using this framework, it allowed now the NITAG and our government to identify the eligible population and vaccination to directly reduce morbidity and mortality and maintain the most critical essential services needed. Secondary goal is to control transmission and to minimize disruption of social, economic, and security functions. And lastly, the tertiary goal is to resume the country's essential activities to near normal. So using these goals, these guided the selection of the priority eligible groups, which are the following: Group A, Group B, and Group C. Under Group A are our frontline health workers, indigent senior citizens, remaining senior citizens, remaining indigent population, and uniformed personnel. Kasama rin dyan yung mga may comorbidities. Group B is really about the workers, teachers, school workers, government workers, both national and local, essential workers, social demographic groups at significant higher risk than senior citizens, indigent populations, including persons deprived of persons with disabilities, IT, high-density areas, eligible students, overseas Filipino workers, and other remaining workforce. Whereas Group C will be the remaining Filipino citizens not mentioned in Group A and Group B. The deployment of vaccines will be in a phased approach, depending on the delivery, say timing, available doses, logistical requirements of the vaccines to the country. It will be executed based on a sectoral approach that is, as mentioned, all frontline healthcare workers will be vaccinated first before moving on to the next priority group. And the number of individuals to be vaccinated in a round will depend on the total number of vaccines delivered, in which the computation per second dose is already considered. Most of the vaccines, by the way, require 2 doses. So since the delivery of vaccines to the country is in tranches, the deployment of the vaccines in specific geographical areas shall be based on the burden of COVID-19 cases. So in the identification of geographical areas, the NITAG set the indicators in determining the areas with a high burden of COVID-19 cases. Now, getting the private sector and local government units involved in the country's COVID-19 vaccination rollout will contribute, obviously, very greatly to improve the implementation of the vaccination program. Okay. Indicated also in the plan is the role of the LGUs. They are mandated by the local government code to take the lead in the implementation of the COVID-19 vaccination program in accordance with the policies and guidelines set forth by the COVID-19 vaccine cluster and the Department of Health. Thus, participating agencies and the private sector are enjoined to closely coordinate with their respective LGUs in which their health facilities are located. They are responsible in ensuring that we follow critical steps in the micro-planning process. This refers to the bottom-up planning process carried out to determine the local needs and gaps to ensure a smooth and satisfactory vaccine implementation. To name a few, LGUs should determine the number of eligible populations for vaccination in their areas. Okay? They must identify the implementing units, the number of vaccination sites, and plot out the operational SWOT maps and the development, obviously, of a waste management plan. We always emphasize to the LGUs that when they discard the vials, make sure they crush them so that these vials cannot be used to propagate fake vaccines. Under the implementation phase, there will be fixed vaccination sites in medical centers, hospitals, rural health units, health facilities of other government agencies, and the private clinics in the respective areas. Local officials and other personnel may also do house-to-house visits to mobilize those who have successfully registered for the vaccination. Now, as for the national government and its regional counterparts, they shall provide the strategic direction, technical and logistical assistance. They will cascade the policies and guidelines and capacitate the implementers. Specifically for each deployment of a specific type and quantity of COVID-19 vaccine, the DOH shall provide a department memorandum detailing the specific operational guidelines applicable for that specific vaccine. Now, private sector. Private sector can play a very important and vital role in the vaccination rollout, particularly in the administration, distribution, and communication. Assistance from the private sector in the distribution of COVID-19 vaccines ensure the best use of equipment, trucks, airlines, hospitals, and other resources needed to meet the logistical requirements for the rollout. They can provide needed assistance pertaining to resource mobilization and augmentation, to shipment and storage of the vaccine. This provides immunization programs with the necessary end-to-end supply chain and logistics systems, ensuring effective vaccine storage, handling, stock management, rigorous temperature control in the cold chain, maintenance of adequate logistical management information system, to name a few. The ultimate goal is to ensure the uninterrupted availability of quality vaccines from manufacturer to service delivery point, so that opportunities to vaccinate are not missed because vaccines are unavailable. This is what we try to avoid. No? So managing the supply, storage, and distribution of potentially multiple COVID-19 vaccines will involve very complex logistical operations, as you can imagine. With the availability of the vaccines and our strict observance of minimum health protocols, masks, face shields, social distancing, proper hygiene, we will be able to curb the spread of the virus and eventually put an end to this pandemic. We invite PMAP as one of our partners from the private sector to support the government in the COVID-19 vaccination program. Ensuring success of the vaccination program is a shared responsibility. Everyone should endeavor to participate in necessary processes and procedures in order to ensure that our deployment and vaccination plan will be effective and efficient in the rollout. It is in this participation that we gain ownership and recognize that it is not only government that is responsible for providing vaccines for all. It it is in this ownership that we will all undertake safeguarding equal access to vaccines, implement quality vaccination services, integrate national interest in the vaccination program, and consider safety and the common good for all sectors. We should be involved in this as a country and as one nation. We are confident that through a whole of government and a whole of society approach, and with all Filipinos united and working together, we will be able to deliver safe, effective, and accessible vaccines for all Filipinos so we can all build back better, allow our economy to recover, and heal as one people and one nation. Palagi ko pong sinasabi, nasa gitna ng ating mga pinagdadaanan bilang isang bansa, ito ang sigurado sa patuloy na kooperasyon ng bawat isa, aahon at aahon din po tayo. Maliban sa panalangin, kailangan natin magtulungan. Dagang salamat, upay adlaw, kaninang karat.
Thank you so much, Secretary. I know that there are a lot of questions coming in. But before that, I would like to take the opportunity to really thank you in behalf of PMAP that you have graced this afternoon's session and that you have provided us with very critical information for not only for our members, because we are live on YouTube, and I think we're more than 900 already now in terms of participation. So we'll just have to go through each of these questions. Let me check what we have here. And I'm glad also, Mr. Secretary, that you have involved also the private sector. And I'm sure PMAP will be very, very glad to partner with you on this. Okay, down to our first question from Julian Kenneth Wahe. All right, on Zoom. Our company is planning to purchase its own COVID vaccine for its employees coming from the US. What is the procedure in relation to coordinating with LGU regarding our program?
If a private company wishes to enter into a tripartite agreement, they must first coordinate with us in the national government. So if you are interested, please email me at ocs.ccss@gmail.com. That's ocs.ccss@gmail.com. So we will process your request. So basically what we have done is we've organized, we've pinpointed certain officials who are in charge of handling concerns like these in private companies who wish to acquire their own vaccine, to help government in acquiring supply of vaccine. So I just want to make some clarifications. Number one, it has to be through a tripartite agreement. You have to understand that the vaccines are not for commercial use. Minsan nakakalimutan nila, isip nila na, okay, kung may FDA, pwede nang bilhin from the manufacturer. No, it doesn't work that way. Remember, these vaccines only have emergency use authorization. Ibig po sabihin, by the name itself, it's for emergency use, not for commercial purposes, not for commercial. Remember, you can do immunization program. That's the same practice across the world. But we also understand that LGUs and private sectors, members of the private sector also want to help. So that's why it has to be a tripartite agreement. Not all vaccine companies agree to tripartite agreement. They would rather just deal with one national government. They don't want to involve anybody. So only certain brands allow or are open to tripartite. AstraZeneca, and So right now, wala na yung AstraZeneca. I don't think they're taking any more orders. Na rin. Na lang is Novavax. So that's the leave plan.
All right. Thank you po, Mr. Secretary. Can we please request Ms. Charm to type in the chat box your email address po so that we would be able to take note of it. Our participants would be able to take note of it. Ito po, ocs.ccss@gmail.com. Please check your chat box. All right. We'll go to the next question po. Will medical staff or frontliners working for both international and local NGOs be given priority for the vaccine? Or rather, how will they be provided for with the vaccine? Thank you. This is from Rojas Mary Ruth.
Well, right now, for medical and health frontliners and other sectors in our society, there is an ongoing master listing. There's a master listing effort going on. That's a joint effort between the national government, the local government units, and sometimes we also involve the private sector. So master listing yan. So for instance, we're already different LGUs that we visited have basically, many of them have already completed subgroup A ng priority group. And this is yung medical and health frontliners, both in public and private hospitals and health facilities. Kasama dyan yung mga barangay health workers and the senior citizens, persons with comorbidities, uniformed personnel, indigent or poor population. So it's already they're already completing the master list for those in subgroup A, and many of the LGUs have now gone doing the master listing for subgroup B. Okay, so the master listing basically gives us an idea of how many heads, how many persons are we talking about in terms of subgroup A, natin. Para kami as a national government will know how many doses of vaccines we will allocate for that LGU or that region based on the number of the headcount ng subgroup A. Okay. Then previous or before the vaccination proper, LGUs must also implement a pre-registration mechanism. Okay, the pre-registration mechanism, and most LGUs are doing an online pre-registration mechanism. That allows us to put a queuing system into the vaccination rollout. So, for instance, sabihin natin na mag-roll out na tayo, sabihin natin sa Quezon City. So Quezon City already has a completed master list. And then in the same manner, they're also currently, they will already do a pre-registration once ready na to roll out. So citizens of QC will pre-register to find out dun sa category A or medical and health frontliners, sino ang nakauna, second, third, fourth. So maganda, may queuing na tayo. Para pagdating sa vaccination rollout, alam mo, basically, anong day, anong oras ka pupunta doon, pang ilan ka sa pila. Para hindi na doon magpipilahan pagdating ng rollout ng vaccine. So that's basically what the procedure is the procedure prescribed, and most if not all LGUs are already doing their current master list.
All right. I see a lot of questions in the chat box, but I think I would be reading those who have sent their questions much more earlier. Here's a follow-up question on the LGU po. Will all LGUs be given vaccine allocation for nationwide distribution? How do we ensure this is available for all who need it? Will Filipinos need to pay for this, or would this be provided for free? This is from an anonymous attendee po.
It's free. It's for free. So we already allocated the budget for it. So libre po ang vaccine. And yes, all LGUs will have their allocation. Kaya nga po, kailangan namin makita yung master list from the different LGUs. So we know how many vials or doses we will be allocating per LGU. And this is not naman new to us, because remember, the Philippines, the LGUs, basically are the ones that implement yung vaccination program ng Pilipinas. Kontra polio, kontra tigdas, kontra smallpox, kontra ito, lahat ng mga vaccination. Pero syempre, mas sanay yung mga LGUs to do vaccination para sa mga bata, di ba? Now walang batang tuturukan dito, mga puro adult ang tuturukan natin dito. But yes, it's for free. It will be allocated to all LGUs. The LGUs will have to determine for themselves saan yung vaccination sites nila. That's why we're doing the code team visits to find out how ready the LGUs are. So far, so good. We've seen very good procedures that were set. In fact, some LGUs even go beyond the minimum requirements. May mga best practices tayo nakikita. And the LGUs naman, they share best practices among themselves. So, unahan ko rin, baka may magtatanong, so bakit yung ibang LGUs nakipag-negotiate pa sa AstraZeneca? Anong advantage ng LGUs na nag-negotiate with AstraZeneca versus LGUs na hindi nag-negotiate sa AstraZeneca? Kung pare-pareho lang naman, lahat ng LGUs will get their allocation. And I guess that's where the confusion is. People think na, yung mga LGU na AstraZeneca, sila lang ang meron. All LGUs wala. No, that's not true. Ako, ang nakikita ko lang advantage ng LGUs that had a tripartite with AstraZeneca is that they're assured na meron AstraZeneca vaccine that will be made available for their respective locality. Yun lang po. Whereas the other LGUs na hindi nakipag-negotiate, they will have their allocation, but depends on what we have on hand. So kung AstraZeneca ang hawak namin, well and good. If we have Sinovac, then Sinovac gagamitin namin doon sa locality na yon. If we have Gamaleya, if we have Novavax, it depends on what we have on hand when we roll out doon sa mga localities na yan. Whereas those na nagkipag-negotiate, meron silang AstraZeneca na parang kumbaga assured na sila na meron silang AstraZeneca. But like I said, doesn't matter naman basta dumaan sa FDA. It should not matter what brand or what country of origin that vaccine is.
Yes, and we see the importance of the tripartite implementation. Kasi nga, sayang naman po yung budget if LGU would be submitting a headcount, and yung headcount din naman po is part of a company na magbibigay din ng vaccine. So doble na po. Sayang din naman po, di ba? So it would be best.
There are also LGUs that allocated the budget for tripartite, di ba? So nakipagsunduan na sila with AstraZeneca, and yet because of the sheer size of their population, what they allocated was not enough, right? So ang national government yung pupunot doon. So there's some LGUs na ganun yung situation.
Yeah, if you say po national government, there's a question here from Reynald Parion asking, is there a particular government agency or NGO authorized by the administration who can take our orders for the vaccine?
I was told by my staff that my words are not clear. Hindi na marinig. Pinky. So I think I need to.
I can hear you po.
I need to disconnect. I need to disconnect and reconnect again. just not too clear now. That's what they're advising me.
Yeah, you're breaking up
It's choppy.
in sometimes it's also clear.
So can I disconnect first and then I'll reconnect in another device now para it won't be. Papalit lang daw ako ng Wi-Fi.
Okay, all right.
Sorry, excuse me for a few seconds. Hold on.
Okay, all right. So while waiting for Cabinet Secretary Carlo Nograles, you can continue to put your questions on the Q&A box so that our back office support would be able to throw this to me. I know there are questions. There are a lot of questions that have been thrown that are already in the presentation. So I will not be reading this anymore. I will just be reading those questions that
Let's try.
that we found in the presentation.
Sorry.
All right.
Sorry, Pinky. Let's try this. Is it better?
Yeah, I think so. Sige po. So going to the next question. This is from an anonymous attendee. We have conducted informal service in our organization. Nagsusurvey po sila. Majority, about 60 to 70%, do not yet trust the vaccines and are afraid to be inoculated. How do we encourage more acceptance nationwide? As we know, this is the first step. Ito kasi, di ba, napaso na po tayo sa vaccine noon. So nakakatakot din po naman, di ba? There were death rates in the dengue vaccine. So yung stigma po, andun pa po. So how would we be able to convince the public to take the vaccine? Mr. Secretary, I think you froze. There.
My internet is also, if you can hear me. We're looking for another device. Anyway, bear with us. It's true that still some sort of aversion or people are still tentative about the decision to get vaccinated. But we expect. Hello.
Yes, po.
Hello. Sorry. Hindi ko alam if you can hear me or not. We expect naman, we expect that the confidence level will build up some more, especially once we start rolling out the vaccines. So with the first priority being those in the health and medical frontliners. Well, two things. Number one, they're just exposed. So, tamang-tama lang sila yung unahin natin. But also, number two, they're also the ones with most knowledge about the med science behind vaccines. So we expect the medical and health frontliners to be more open, more to taking the vaccine. But I think once we start rolling that out at makikita naman na okay naman, wala namang problema at safe naman. Yan sa ng ating mga kababayan.
Medyo po choppy na po tayo. I think the previous one was much better. Yung previous connection niyo kanina was much better po. Anyway, Mr. Secretary, can you hear me? Mr. Secretary? I think we lost him again. He'll probably reconnect. Okay, moving on. I know that we have not. You froze po.
Is this better?
Just try turning off your video. Probably it would
Okay.
save on the back.
There.
All right.
Okay.
You still have to answer the last question po, yung is there a government agency or NGO authorized by the administration who can take our orders for the vaccine? Medyo choppy po kanina, hindi ko kayo narinig.
Taking orders for the vaccine. Alam nyo, I don't know what the question entails. Taking orders for the vaccine, does that mean yung pagpasok sa priority list ng babakunahan? Or if it's to, as a private sector, to participate in a tripartite agreement? So if it's to participate in a tripartite agreement, like I said, please direct your question to my email, to our email address, ocs.ccs@gmail.com. But for prioritization, well, the prioritization listing of the subgroups is prescribed by our National Immunization Technical Advisory Group.
I hope that was clear enough. The first step really is to send an email so that they would be able to create a tripartite coordination. All right. Again, on the double allocation, there's a follow-up question from an anonymous attendee. To avoid duplication between local government and private companies in the allocation of limited supply of vaccines, will there be a centralized registration by the government for those who would be vaccinated?
Yes, there's a centralized registration system it's where we log in and put in all of those who have been vaccinated, and that allows us to look at how many doses na ang nakuha na ni Mr. Juan de la Cruz or Miss Juana de la Cruz. We know that where they are from. We know the date na kung saan kailan siya nagpapakuna. And in the future, if nangailangan tayo ng vaccine passport for whatever purposes, then we will have that database that allows us to generate some sort of vaccination passport in the future if it is needed.
All right, pero with the expectation that the vaccines will arrive this month, especially for Group A, we hope that integrated report or registration is already in place po.
Yes. Opo. It already is kasi we already have a dashboard naman for it.
May question din po ng isang anonymous attendee na alam niya yung Group A, Group B, Group C, I think. But he questions why are the laborers or the workers not prioritized when they are the ones exposed, they are the ones commuting, no work, no pay?
Yes, because they're prioritized naman. They're just in subgroup B, no? Kung mapansin mo yung subgroup A, like I said, this is based kasi on the SAGE framework set and prescribed by WHO. So we're just following that. And that's the same as what other countries are doing. So if mapansin ninyo, una yung medical and health frontliners, diba? Senior citizens and those with comorbidities. Because medical and health frontliners, sila yung most exposed. Sila yung humaharap ng pasyente every day. And like I said, I think even in building up confidence, sila yung mas open to taking the vaccine. So I guess that's deliberate maybe in terms of the WHO na sila yung unahin na ipabakuna because they're the ones with the highest confidence levels in vaccines. But also because they're the most exposed, more than anybody else, more than any subgroup. And then the senior citizens and those with comorbidities, because they're the ones most vulnerable naman, right? Most vulnerable. And then based on equity and other values as prescribed by the SAGE framework, mauna yung mahirap na mga kababayan natin. Kasi madalas yung mga mahirap natin na mga kababayan, isang grupo yan. Sila yung nangangailangan talagang lumabas at magtrabaho. There's no work, no pay. So sila yung mauna dun sa subgroup A. Then sa subgroup B, doon na papasok lang yung workforce. Papansin niyo, dyan papasok yung workforce. So again, this is based on the SAGE framework. I might as well just say it, but the workforce, kasi usually yung workforce naman natin, they're not as vulnerable as the senior citizens and those with comorbidities also. So we have to understand na what we're trying to protect here is hindi pumunta sa severe disease yung mga nasa mga senior citizens and those with comorbidities, because we're also trying to control mortality here. Diba? Deaths. Ang bottom line natin dito is to prevent deaths.
Yeah. All right. Related to the question a while ago, if private sectors can purchase or have their own vaccination plan, do they need to seek government's approval prior to roll out to their companies? I think this has already been addressed in that private.
Yes, because ano yan part of those private companies that already have entered into a tripartite agreement, briefing na yung mga yan, briefing na yung mga companies ng all the things that have to do with the rollout, and we're constantly in coordination with them.
All right. Pag sinabi po naman natin na kung ano yung role nila, halimbawa, if you're a nurse, it doesn't matter po, no, if you are a private nurse or a government nurse, or if you're a teacher, you're a private teacher or a public school teacher, as long as you're a teacher, right?
Yes, tama po yun. Correct, public or private.
Okay po. These came out in the questions also. Another question po, if a health worker is previous COVID positive, will he or she still be entitled for a COVID vaccine, given that the patient have already developed an immunity before? Thank you. This is from an anonymous attendee.
I will leave that up to the DOH to answer, kasi I might not be the expert to answer the question.
All right. True enough. We're not the best people to answer medical questions.
Not the doctor.
If you are immunized po, diba, sometimes there are adverse effects. There's a question coming from Elrani Joseph Bautista. Will you require, or would you be providing a fast lane in every hospital for possible adverse effect following the immunization?
Let me answer that now by saying that we have a national adverse effect after immunization committee that handles that. So yes, may mga protocols and procedures, including medical and health protocols and procedures, even during the rollout. So if you look at the layout of the vaccination centers, you will see that one of the rooms that will be allocated are rooms for monitoring yung mga nabakunahan. And you have to stay in that room for about 30 minutes, I believe. And then in that span of 30 minutes, you will be 30 minutes or an hour. But anyway, let's say 30 minutes. In the span of 30 minutes, they will keep checking you regularly, no, vital signs. They'll check your blood pressure, your heart rate, breathing, and all of that. So para to monitor, no. Then after that, they'll also give you specific instructions, no, about where to report anything that you feel after the vaccination when you go home. So nakaset na yung protocols dyan, and dun sa mga areas na yon, there are medical teams on standby, and even ambulance. May mga ambulance nang naka-standby dun. So we've seen that in the rollout. We've seen that in the simulation exercises also. So yes, my special lanes, my medical team on standby, my ambulance pang naka-standby dyan.
Okay, that's good to know. Siguro they're just concerned, lalo na po nasa bahay na po sila. So, and there would be a need to go to the hospital because of that. Okay, thank you so much for that po. There's also another question here, anonymous attendee. Nako, dami nating anonymous questions po. Saan po magdedepende yung free vaccination to be distributed sa LGUs? May maximum quantity of vaccine po ba per LGU? I think maybe because given the fact that limited po yung supply. So let's say, would you be prioritizing yung or will you just be getting an average number of the LGU, or just all group A's lang muna ng LGU for the first tranche? How are you going to go about this distribution, especially with the limited supply of the vaccines?
Yes, tama ka. All group A's muna. Then we go from one region to the next region. The first region will be NCR because this is where we have the highest number of COVID cases. Because we have to remember, we have to put some sort of order, no? So the NITAG showed us a graph of their decision process and the weights they gave per region, kung bakit ano yung sequence ng regions. But of course, hindi pa yan final because the weights are final. Yung weight attribution is final. Weight distribution is final. But in terms of the regions, syempre nagsishift pa yan depending on the situation, di ba? But the basic premise is, uunahin muna natin yung regions where they have the highest attack rate and growth rate and transmission rate and cases of COVID-19. Then we go from one region to the next. But yes, unahin muna natin lahat ng nasa subgroup A. And then ubusin natin lahat ng regions, then come back for subgroup B. And then the same process all over again.
Thank you so much. You're in coordination, your team is in coordination naman po with DOLE, ano? Because our participants are also asking if DOLE will be issuing an labor advisory, mandating all employees to be vaccinated.
When we go to subgroup B, which is where most of the workforce is, DOLE naman will issue the necessary issuances. Baka kasi ang tanong is, paano ko magpapavaccinate kung may pasok, di ba? I guess that's the premise of the question. So yes, DOLE naman is part of the group. Kung ano yung necessary issuances, ilalabas naman ng DOLE yan para to give way to the employees to get their vaccine.
Alright. Okay. In terms naman of, kasi mga private sectors naman talaga yung nagpo-coordinate din ng DOLE na, meron ba tayong minimum and maximum number of orders for the private companies, and when they would be buying these orders, or controlled ba to ng government, or it really depends again on the tripartite agreement?
Yeah, it depends on the tripartite agreement. Pero sa pagkakaalam ko, in the first and second round of that tripartite agreement, they usually ask they usually ask the companies kung how many orders ang kaya nila. And then, I think sinasubmit ng companies yung orders. Tapos gather yan lahat. And then, they will negotiate with the vaccine company and ask the vaccine company how many orders they can take. Then from then on, kung kaya ng lahat ng orders ng lahat ng companies, then okay. Kung hindi, then mag-adjust ka.
At least ngayon, I think DOLE has numerous tripartite councils that they can work with. Halimbawa, yung tripartite council for the hotels, meron silang tripartite council for the BPOs. So, pwede po kayo magpapapagod.
Yeah, I think the tripartite that you mean though is government, private company, di ba?
Yes.
And the employee. Here, yung tripartite agreement natin ng vaccine is the vaccine manufacturer, the Republic of the Philippines, and the private sector group. That's what the tripartite is. For LGUs, it's the vaccine manufacturer, Republic of the Philippines, and the respective LGU. Kasi LGUs are its own companies naman.
DOLE can also play a great role in this, Mr. Secretary, because the members of their tripartite councils are private companies. So yung isahan na kung ano ba yung agreement ng tripartite, meaning the manufacturer, yung government, at saka yung private company, the information cascade can also be done through them. That would be a good channel as well. All right, here's an interesting question po, again, from an anonymous attendee. Hi, what if we conduct a vaccination on our organization, then someone develops adverse effect that could lead to disability to work or worse, death? Who is responsible for that?
Well, first of all, if anyone, any Filipino gets any adverse reactions to the vaccine, that's covered by PhilHealth. That's covered by PhilHealth. So that's the current setup that we have today. Now, with regard to your other questions, I believe that Congress, I mean to say the House of Representatives and the Senate, is currently finalizing an indemnification law that will cover other adverse effects, yung adverse effects ng immunization at kung ano pa mga benefits ang nakapaloob dyan. So right now, without that law, automatic na PhilHealth law will cover. So whether or not that law passes, PhilHealth will cover patients that have adverse effects after immunization. But with regard to other benefits, perhaps that's something that Congress is currently finalizing.
Okay. There's a question coming from our Facebook channel from Gpay Denla Delaes. Yung mga nasa private sector na pumasok sa tripartite, will the vaccines be stored initially in the government identified cold storage? Or who will take care of? Halimbawa po, if there's a number of vaccines already determined for a certain company out of the tripartite agreement, who will be responsible for the storage? Is it the manufacturer and would go directly to the company during the immunization already or vaccination rather? Or would it be turned over to the local government unit and the local government unit would have its own cold storage? What would be the temperature? I mean, is everything already dictated by national government so that every vaccine is already safe? Kumbaga po.
Right now kasi yung napag-agrihan ang nakapag-tripartite agreement lamang right now so far is AstraZeneca. So luckily, AstraZeneca does not need naman -70 or -60 or -20. So refrigerator storage lang yung kailangan ng AstraZeneca. So that's not really a problem. It's not as sensitive as, let's say, Pfizer, that is -60 or -70, or even Moderna, that's -20. So I don't think that it would be a very sensitive matter in terms of the storage ng kasi refrigerator temperature pwede na ma-store yung AstraZeneca. Okay. So that being said, in terms of how it will be yung mga companies that have tripartite agreement, paano yung rollout niyan? I believe that's still currently being finalized kung saan, no? Kasi that's a unique situation to be in. Madali lang yung mga LGUs na tripartite kasi because syempre sa LGU yung vaccination, di ba? But for private companies, I think that's still being finalized. Anyway, yung sa private companies will come third quarter pa naman. So we still have time to finalize the details on that. But mauna kasi yung national immunization program. And once we are able to perfect that system, then during the immunization stage itself, the rollout, we'll finalize kung ano yung arrangements natin with the private companies in terms of their own vaccination efforts sa third quarter ng 2021. Because ang iniisip ko kasi is syempre it's more convenient to have it kung saan meron na tayong vaccination site, right? Kasi nakaano na yun kumbaga nandun na yung vaccination sites natin at sanay na, kumbaga nagkasanayan na. Kung start tayo first quarter, second quarter, sanay na alam na yung flow, memorize na. So I don't know, might be better to just do it there also for the private sector, right? But I don't know, we hear some private sector also saying na kaya, so that's why it's still being finalized.
Okay. So we have a lot in store pa. We will just wait for updates coming from you. Anyway, it's in your websites, and please do coordinate also with us. Let your team coordinate with PMAP, and we can send it out to all our members and post this in all our social media platforms. Okay. There's one question, or probably it's not a question. It's let's say a comment from Ray Lyndon Yanes. One issue raised last week was that of an OFW who had his COVID-19 vaccine in Dubai, but still tested positive in Mandawi City. With this issue, how will you motivate people to trust that the program will effectively reduce the transmission and prevent one from infection?
Okay. This is a difficult question to answer. Okay. But let me attempt to make an answer. Siguro the first part of my answer is that we have to understand that the operation of the vaccine is that it prevents you from going into severe disease. Okay. Most of the vaccines out there give a 100% effectivity or efficacy rate of not graduating to severe. All right. So yun yung pinaka-effect ng vaccine niya. So some vaccines are also, they have a higher efficacy rate na you won't graduate to moderate. Okay, so that's where you see 95, 89, 86, 85, yun. Those are the efficacy rate na you won't graduate to moderate. But most of these vaccines guarantee that you won't graduate to severe. All right. Some naglalaban-laban, katalo-talo sa percentage na hindi ka mag-moderate. So that being said, you look at those the OFW na nakakuha nung vaccine abroad and went home, they're pretty much asymptomatic or at the most mild. So meaning to say, the vaccines work in the sense na kampante ka, na you might get COVID, but it won't graduate to severe. So that's your protection. That's what we are investing in the vaccines on. Again, the bottom line is we have to reduce death. We have to reduce the mortality rate. Yan ang pinaka-ultimate goal ng vaccine na yan. So you don't graduate to severe, higher chances that you don't graduate to moderate. You may get it, you still may catch it, but it will be very mild or you will just be asymptomatic. Kaya nga, we have to, ang caveat natin sa lahat ng tao sa buong mundo, by getting the vaccine doesn't mean that kalimutan mo na yung mask, hugas, iwas, face mask, face shield. Tuloy pa rin yan. Because you still can be a carrier. You might not feel it kasi asymptomatic ka, but you might be still carrying the disease, the virus. So yun pa rin, di ba? Hugas kamay, so face mask, face shield. And later on, as we see the cases going down, di ba? Halos asymptomatic or mild na mga cases, ganyan, and as we start to flatten the curve sa buong mundo, hopefully, ma-stamp out mo na or matanggal mo na yung coronavirus itself. It's not going to be 100% gone, by the way. Just like smallpox, measles, chickenpox, polio, it's still going to be there. But this is really the long-term solution in vaccine. Just like vaccine against polio, chickenpox, measles, smallpox. Yeah. So, ganun. Yan ang labanan dito. And that's a world solution to the problem. There's no other solution out there.
Thank you so much. There are some questions that are medical related. We will try to have another session with the Department of Health so that we would be able to, unfair naman po kay Mr. Secretary, he would be answering medical related questions naman po. So we're down to our last 3 questions because of time, and we don't want to take much more of your time po. I know you're a very busy person. There's a clarification lang po on the expats. Some companies have expatriates who have valid work visas. What priority group do the expatriates fall under? Yung private pa rin po, private companies pa rin?
Yeah, the workforce na yan.
Workforce pa rin po. All right. Okay, we're down to our last. Save up.
Yeah.
Okay.
But if not,
we're down to
strictly, kasi they're not strictly Filipinos, di ba?
Yeah.
So I don't know if they'll belong under subgroup B or C, ha? Kasi ang C kasi the rest of the population that's not in A and B. So I'm not really too sure if they will be considered. Depends on NITAG. We'll have to ask the NITAG how to classify expats.
Yeah, because the free vaccines are for the Filipinos, diba? So if they are expatriates and should their companies decide to buy the vaccines for their expats, is this included in the tripartite agreement then again? Okay, yun po ang ka-clarify po natin. From Jeffrey de la Serna, Cabinet Secretary, please expand Group A4, frontline personnel in essential sectors. Do we have a list, especially private industries? And post tripartite agreement with Astra, would you have an update regarding the deployment plan?
No, not the deployment plan ng Astra sa private, sa tripartite. I don't have any updates on that. Yung sa essential workers, wait, hold on. Let me get back to you on that. I'll ask for the document from the staff.
All right. Sige po. So let's just change the question. Ito naman po, another one related to death due to the vaccine ata. The company had properly coordinated with the government and received a go signal from the government. If a private company decided to purchase vaccines for their employees and something happened to the person vaccinated, the person vaccinated or the family of that person wanted to file a criminal case, the person died, or civil case from what happened, who will be held liable, or who can the person or family sue? Is it the government or the private company who will be held liable under the law? Thank you.
Sorry, I missed out the first part. So the immunization program was done through the tripartite ng private company. Then after the adverse effect,
A member of the family died, and who can they run after? Who can they sue? Like if the family should the family sue the company, the private company who did the vaccination program, or should they sue the government, or should they sue the manufacturer? That's what they're asking.
let me get the NITAG to answer that. And the committee on the adverse effect after immunization. So there's a committee called the National Adverse Effect After Immunization Committee. They should be the ones who should be prepared to answer that question.
All right. And then for our last question, will you consider putting COVID vaccination commercials both on TV and social media before the vaccination rollout? This is to let the people in all sectors get the education they deserve and para mapa-oo natin sila, from an anonymous attendee.
Yes, actually, there is already a plan, joint effort, both by the national government and those in the private sector, to roll out a comms plan, a communications plan, to increase confidence sa vaccine. So, merong sariling efforts ang government on that. But there's also an initiative from certain private sector companies who have volunteered to also support that program. And hopefully we can launch the program soon. I mean, yung national program, syempre, we're already going to start doing that as a comms plan. But may private sector campaign also helping the government sector in terms of building up also confidence. So we're also looking forward to that happening, and very soon, hopefully, we'll be able to get that.
All right. That's the best way to reach everyone, especially through social media. So we have questions in the or comments in the chat box. If we could have a copy of your presentation, maybe a copy can be given to PMAP, and PMAP would be able to share this with all the attendees. Is it possible?
Yes. Yeah, we can
right.
use presentation ko. Pwede naman po.
All right. Thank you so much po, Mr. Secretary. Thank you so much for the time that you have spent with us. Although medyo may mga challenges po tayo sa technical capability po, we're only in the Philippines, di ba?
Yeah, depends on the time. Sometimes maraming gumagamit ng internet. That's why I had to get my I had to fish out my internet device. That's why I had to switch internet kasi here in the office, we're in one building, and then I guess nagkasabay-sabay paggamit. That's the reason for the unstable connection.
Sabay-sabay po silang nanonood sa inyo sa YouTube po, kaya naubos yung bandwidth. Thank you so much. Thank you so much po. All right, so everyone, we should remember that this what you call this vaccination program must be synchronized, and the government is taking a collaborative approach from the president to all the local government units and the private sectors as well. We are warned by by Mr. Secretary to have extreme caution on prices of vaccine online, as currently they are still doing negotiations with the manufacturers. There are different vaccines like BioNTech by Pfizer, AstraZeneca, Moderna. These all these will be reviewed by FDA, and whatever FDA will approve, all the private companies can do a tripartite negotiation with the government and the manufacturer to buy the same. So we are hopeful that the vaccines will arrive this month, and a successful rollout on the right track has been approved by WHO. They know that we are ready in terms of regulation, and then there's a presence of national vaccination deployment plan, and we have storage facilities for the vaccine. It's already available, and there's a safety monitoring plan to check for possible adverse effects of the drug. So again, in prioritizing recipients, we have three groups. Group A are the frontline health workers, indigent senior citizens, remaining senior citizens, and remaining indigent population and uniformed personnel. For Group B would be the teachers and school workers, government workers, national and local government, and this is private and government, essential workers, social demographic groups at significant higher risk other than senior citizens, and indigent populations, including persons deprived of liberty, PDLs, and PWBs, indigenous peoples, Filipinos living in high-density areas, eligible students, overseas Filipino workers, and other remaining workforce. And lastly, Group C, the remaining Filipino citizens not mentioned in Groups A and B. We have to remember that the LGUs have a critical role to play in following the micro-planning process to consider local needs to ensure a smooth vaccination implementation. So it would be good for you to coordinate with your LGUs. The private sectors also play a critical role in the implementation of the vaccination program, like the administration, the distribution, the equipment, the storage, needed assistance in resource in mobilization, and the augmentation. We need to work with government in order to have a very smooth vaccination process. The implementation of a smooth process is everyone's responsibility. It is not only the government's responsibility. So for companies who are planning to buy their own vaccines, they need to coordinate with government first on a tripartite process. Email to ocs.ccss@gmail.com. Again, ocs.ccss@gmail.com. At the end of the day, though vaccinated, we should continue to practice preventive health measures, continue to wear masks, sanitize all the time, practice social distancing, and regular disinfection. And with that, this ends our session for this afternoon. We thank everyone for their active participation and involvement. We hope that this session was helpful. For more webinars, don't forget to like and subscribe to our YouTube channel and other social media accounts. Thank you so much, and thank you so much, Mr. Secretary.
Maraming salamat po. Ingat, amping, kanunay. Thank you. God bless, God bless. Ingat po.
I know you know. You've seen it, experienced it, affected by it. Of course, it's hard. But this is an invitation to change it, to bounce back, to feel the inspiration. Masyado ka nang apektado para tumigil pa. Ngayon, oras na para sa mas mataas na antas ng pagbabalik. Masyado ka nang apektado para tumigil pa. Ngayon, oras na para sa mas mataas na antas ng pagbabalik at pagbabago. The hashtag business as usual. Oo naman, aangat ka, aangat tayo. The 58th PMAP Annual Conference. Angat, leading people to higher ground. Be the soul of change. Be the pusher of encouragement. Be the fuel of moving forward. Angat.
Be the soul of change. Be the pusher of encouragement. Be the fuel of moving forward. Angat. Leading people to higher ground. The 58 PMAP Annual Conference. Dahil mas personal na ang trabaho ngayon.
bounce back, to feel the inspiration,
affected by it. Of course, it's hard, but this is an invitation
mas mataas na antas
change
ng
it,
pagbabalik
to bounce
at
back, to
pagbabago.
feel the
hashtag,
inspiration.
this
Masyado
is
ka
as
na
usual.
apektado
Oo naman,
para tumigil pa.
aangat ka,
Ngayon,
aangat
oras
tayo.
na
The
para sa mas
58
mataas na
PMAP
antas
Annual
ng
Conference.
pagbabalik
Angat,
at
leading people
pagbabago.
to
The
higher
hashtag,
ground.
business as usual. Oo naman, aangat ka, aangat tayo. The 58 PMAP Annual Conference. Angat, leading
Be
people
the
to
soul
higher
of
ground.
change. Be the pusher of encouragement. Be the fuel of moving forward. Angat, leading people to higher ground. The 58 PMAP Annual
Be the soul
Conference.
of change. Be the pusher of encouragement. Be the fuel of moving forward. Angat, leading people to higher ground. The 58 PMAP Annual Conference. Dahil mas personal na ang trabaho ngayon.